Okay, good afternoon, everyone, around the table and around the room. We are this afternoon going to hear from the Secretary of the Agency of Human Services and the other folks that she has brought with her. This is part of our sort of like orientation and education. We have responsibility for a good chunk of the Agency of Human Services. And so we are fortunate to be able to have Jenny Samuelson, who is the secretary here, and feel free to join us at the table. We are going to go around the room, around the table first, because this is the first opportunity. We have 6 new members on our committee, Secretary Samuelson, and you have some new folks with you as well. Well, relatively new. I'm Representative Teresa Wood. I'm from Waterbury, and I also serve Bolton, Buellsport, and Huntington.
I'm Ray Garofano. I live in Essex, and I also represent Essex Junction.
Lena Gill. I live in Bridport and represent Bridport, Weybridge, Tilbury, and New Haven.
Hi, as I call it, I represent Hartford.
Hi, I'm Zon Eastis. I represent Guilford and Vernon.
Good afternoon, I'm Todd Nielsen. I represent Anthony Marshall.
I'm Brenda Steady. I represent East Milton and Westford.
Doug Bishop, representing Colchester's Chittenden County District.
Good afternoon, Dan Noyes. I represent Woolpit, Hyde Park, Johnson, and Belvedere.
Hi, Ann Donahue from Northfield, also representing Berlin.
All right, and then we'll start here and go around the outside.
Yeah, me, Brendan, after the Foster Services.
Brenda Siegel, Executive Director of End Homelessness Vermont. Amy Johnson, Vermont. Katie Steiner, Lester.
Swallow.
Oh, me. Lori Morse, Lead Assistant.
Thank you. And then welcome to our folks from AHS, and please introduce yourselves for the record. And committee members, we do have a presentation on our iPads, and looks like Brendan is ready to pull it up on the screen when he's asked to. So thank you very much. Welcome.
Thank you for having us here today. For the record, I'm Jenny Samuelson, and I'm the Secretary for the Agency of Human Services here in Vermont.
And good afternoon. For the record, I'm Krista McClure. I'm the Deputy Secretary at the Agency of Human Services. Good afternoon. For the record, my name is Monica Ogilvy. I'm part of the executive leadership team at the Agency of Human Services, and I also serve as the State Medicaid Director.
Thank you. I presume you have it in paper because we have new members. Most of the time we don't need paper. Okay, thank you. Well, you'll have to print off your own, Representative Steady.
I have one.
Oh, we don't get it. I'm on the select board. They don't give us paper either.
If anybody around the outside wants one, we have 3 spare copies here if you would like. Thank you. All right, it's yours.
Thank you. And Chair, thank you for having us and allowing me to bring members of my team. I think you all heard Brendan Atwood, who is another member of our senior leadership team at the Agency of Human Services and our policy director. One of our goals for bringing our members of our executive team here today, in addition to the commissioners who you will see throughout the session, is to really give an introduction, help orient folks to the team that we have, and to ensure that you'd be excited to answer your questions and have outreach from you. Our goal is to go through the broad agency and its structure, and then to walk through in brief each one of the departments within the Agency of Human Services to give you an overview of the breadth and depth of the agency itself. So to begin, the Agency of Human Services mission is to improve the conditions and well-being of Vermonters. And our vision is that Vermont is a place where all people have the opportunity to thrive in inclusive, equitable, and resilient communities. I think the breadth of the agency with its 6 departments and healthcare reform really allows us to be able to work across a wide range of topic areas in order to help us achieve this mission and vision. The benefits of the Agency of Human Services within its 6 departments is it efficiently manage the delivery of health and human services. It divides the responsibilities that we have into distinct areas. Each of our departments has specialization. Many of them wear 2 hats. The hat of ensuring the population health in their content areas and ensuring that we meet that and the needs of the most vulnerable populations, particularly implementation of our Medicaid program. By having each of our departments be able to dig deep in areas like mental health and substance use, we're able to really look at what the best practices are across the country and across what's emerging across the world in terms of the best care and delivery of the types of services that we have. But we understand that the people we serve, the communities that we serve, and the families that we serve are more than just one topic. And so by putting the different services together within the Agency of Human Services, it allows us to collaborate across the boundaries of the department so that we are able to serve the whole community, the whole family, and the whole person, not just one element of their health or well-being. And so collaboration, you'll hear throughout our presentation today, is really a key and a driving force within the agency. And I can say that having been at the agency for nearly 20 years, the pandemic really catapulted that forward. And we have continued to make sure that that has been a centralizing force of the work that we do. In addition to that, the agency is able to manage complex cases and maximize federal funds. An example of that is our Medicaid program. We're able to make sure that we're using that across the full breadth of the agency. Many people think of it, one of our departments as our Medicaid program. That's the Department for Vermont Health Access. We'll go through that. But in reality, the Department for Mental Health administers our Medicaid mental health programs. Our Department for Disabilities, Aging, and Independent Living administers programs for those who are aging or who have disabilities. And our Department of Corrections now even is implementing programs within corrections. And so having us together helps us to efficiently deliver services and maximize the funds that we use rather than having it spread across state government. So generally, the agency has a central office. That central office, the secretary's office, holds a few key programs. It in addition to our leadership across the agency, and our leadership is really driving that collaboration, ensuring coordination, and assuring innovation across departments. And I think that that's reflective of what our central office team is. We have healthcare reform or health reform in the central office. That's really driving reform across healthcare and human services. And so when we think about that, it's how do we change the way that we pay? What are the types of services and the way that those services are delivered and changing that? And how do we collect the data and analyze that data in a way that makes good key decision making? And the Office of Healthcare Reform with the Blueprint for Health and the Health Information Exchange can really drive those across the agency. And a few years ago, we did work around healthcare stability, and that office really helped bring together providers from our community as an example and our departments and said, what do we need to do to stabilize our healthcare system post the pandemic? And they were able to say, we need things like a place to call when someone's in mental health crisis. We need to expand out the acuity of the types of services in our skilled nursing facility. The Office of Healthcare Reform identified that, and then our departments really, you'll see through the initiatives that that have been done and that are doing, really implemented those. And that's the value of having healthcare reform there. In addition to that, our Medicaid program cuts across department boundaries. And so our Medicaid director and Medicaid policy sits in the central office. So our 6 departments beyond the central office include the Department of Health, or the Vermont Department of Health. That's our public health department. Department for Disabilities, Aging, and Independent Living. The Department for Vermont Health Access, which administers some of our core Medicaid services. Department for Mental Health, Corrections, and the Department for Children and Families. I do want to point out, this isn't the committee of jurisdiction necessarily for it, but the Department of Corrections in the Agency of Human Services is unique to Vermont, and I think it reflects Vermont's values at looking at the individuals who we serve in our correctional settings, at looking at how we address the root causes of why they are in our correctional system, and allowing us to provide the supports like mental health treatment, substance use treatment, workforce, being able to bring in the other parts of our agency so that our correctional system is really a rehabilitative system. The other components of the Agency of Human Services are reflective of what you see across the nation, being in an Agency of Human Services in many of the states across the country, so that we can comprehensively deliver those services. The Agency of Human Services leadership team, I want to make sure that you had our names and contact information. There's myself, the secretary, Kristen McClure is our deputy, Monica Ogilvy, our Medicaid director, Brendan Krause, wanted everyone to be able to put a face to a name. You will also see Rich Donahue, who is our chief financial officer. He and I will be back to walk through BAA, I'm sure, and parts of the budget. And then Brendan Krause, who is our, Atwood. Did I get Krause already? Okay. He's Krause is director of healthcare reform. We only hire people with the name Brendan and Sarah lately. Brendan Krause is director of healthcare reform. And then Brendan Atwood, who is here with us today, is our director of policy. So Brendan Atwood. I said Brendan Krause and pointed to Brendan Atwood earlier. So Brendan Atwood is our policy director. I just want to make sure that you know that we are all accessible to you. If you have questions or answers, you will see most of us in the building. But Brendan Atwood, who is here today, will be a primary connection for many of you.
So how would we find you? Excuse me, I'm new.
You don't need to raise your hand. Just,
Oh,
it's
I
okay.
knew, I forgot.
Yeah, Representative Steady.
Thank you. How do we find your how to contact you?
Brendan Atwood can get you our contact information.
Representative Steady. Do you want to?
Absolutely. And if you ever see me in the building, you can always pull me aside.
Okay, I'm extremely shy, so you can tell, right?
Yeah.
So it's hard to talk about the Agency of Human Services without talking about what our values are and how we actually approach the work that we do. And for us, we really do, for me, I really believe in living by the values that we've set forward. For us, transparency is key. Being open about the types of services, how we deliver those services, being able to solicit input from providers and input from individuals that we serve is a part of that integrity. Being open about the things that are both going well in our agency and when things go wrong. And this is where transparency and integrity come together. Really being able to lead from an ethical space, being open when things don't go right. We are an agency who serves very complex individuals, and things sometimes don't go the way that we had hoped. So that's part of the integrity. I have to say it's a privilege and honor to work with a group of dedicated individuals who really are who really focus on providing the best services to the clients that we serve, as well as ensuring collaboration with the other agencies through that real lens of a service mindset. When we approach the work that we do, and I think particularly post the pandemic, this has been important. Our world is constantly evolving. And so our leadership team leads from a space of innovation. We know that things change over time. For example, the substances that we're seeing used in substance use are very different today than they were 10 years ago when we did Hub and Spoke. And so innovation is a core component of what our leadership team is driving for. And that innovation, it's important for us, happens across the boundaries of the department. So collaboration, so across the boundaries of departments with our providers in our communities and across the boundaries of agencies. So for example, strong collaboration with the Agency of Education. And so collaboration is a key foundational practice for how we do our work. And then the staff that we have within the Agency of Human Services is probably one of the most dedicated staffs that I've had the privilege to work with. And so that's a core value when we hire. We're looking for people who really are dedicated to serving Vermonters. And most of them could go and do something somewhere else that's a lot easier and earns potentially is a lot more lucrative. So when you think about the Agency of Human Services, we are the largest agency in state government, both by the number of people and overall by our budget. From a general funds standpoint, or meaning state dollars that come into our agency, we are about $1.3 billion total. In addition, though, that adds up to, once you put in federal and other funds, us expending about $5.2 billion total in services across all funds. So we are a large component of state government.
Excuse me.
Oh, I forget. She's going to train me, really.
Okay. Yes.
Is this anticipated or is this what your budget is
Current
now?
budget.
Current budget.
This is current fiscal year. In addition to that, it's important to note that we've got a little more than 4,000 employees, and you can see the breakdown. Our two largest departments are the Department for Children and Families, the Department for Corrections. And then there you can see after the size of the departments within our agency. But overall, it's a little more than 4,000 employees.
Representative Downey has a question.
I'm sorry, if you flip back to the budget, general fund budget by department. The way it's done in colors, of course, more than half is global commitment. But that then isn't, so there obviously isn't a Department of Global Commitment. So is there anything that shows how much money is in each department, including, because some corrections doesn't get any global commitment?
The good thing is that we will be back in the next couple of weeks to walk through our budget in more detail. I can definitely, Brendan can get that to you before then, but it will break down the budget by department. For those who are new, I want to explain what global commitment is in a very general level.
We're going to be having a Medicaid 101 as well.
Right. And I'm hoping that Ashley Berliner can join you and Nolan for that. So essentially what happens at the federal level is that funds come into the state of Vermont. They are Medicaid funds, and they are matched with federal funds. The global commitment funds sit in the Secretary's office at the Agency of Human Services, and then funds come in and are matched with our federal funds. That the combination therein is becomes our global commitment. And so that's the way to remember it. Global commitment equals Medicaid. That is then distributed. And I'm sure Nolan and others will be like, oh my gosh, how does she describe it? But then that is distributed, as Representative Donna, you said, across the departments. And Monica our Medicaid director, will walk through each one of our departments. And what you will see is that Department for Mental Health, Department for Disabilities, Aging, and Independent Living, every one of our departments is touched by Medicaid funds, but there are some departments that play a huge role. Department for Vermont Health Access are our three largest departments for our Medicaid funds. The money is distributed out to them to deliver the services. Great question. Thank you.
And I just think just for simplicity and for people understanding, this is probably not a very helpful chart. And what would be helpful before getting to the big breakdown of budgets is a similar chart that divides it, including
By department.
by department, including where the global commitment money is broken into, so that you have a sense of how much money is.
Is that only the general fund portion of the global commitment? Yeah,
Yeah.
because it's a GF.
Right.
That's the general fund.
Right.
So, and Representative Donahue, I actually have our BAA testimony with me. I can show you that slide before I go, but we will be in shortly, and that is one of the slides. So I appreciate your feedback on that. Okay. So in addition to, for our agency, when we think about the agency broadly, we've talked a lot about departments, and we think about those kind of centrally, but the Agency of Human Services delivers much of its services at the local level. And we do that in multiple ways. We have district offices, and Deputy McClure is going to go through those. We also, the majority of the services that we do, and while we have 4,000 employees, a lot of the services that we do are done through agencies who provide services across the state. So you will hear us talk significantly, for example, in this committee about designated agencies. That term you'll hear used means the agencies that deliver mental health services, some substance use services, and developmental disability services. They're all done by one agency in communities across the state. We also have other agencies that we work with, or other types of organizations that we work with. And that's how most of our services are delivered. Vermont made a decision to really support a network of nonprofit organizations. But in addition to that, we have a footprint locally because we believe strongly that services are delivered at the local or regional level. And so we have 12 district offices across the state.
Thank you, Secretary. And as the Secretary mentioned, we have 12 different district offices in 12 districts. And the way it is color coded is we have one field services director that covers 2 districts. So the field services director is a very high level position at AHS that collaborates with legislators, with municipal leaders, with local community members, and really helps problem solve some of the complex situations within the community. So a direct relationship for that district to work with. In the district offices, there are also healthcare nurses that promote health and wellness, and that also work with some of the most complex individuals and really engage the full network of providers as part of their care. Also in the district offices.
Before you move to children and family, are the healthcare nurses, are those VDH staff? Are they Dale staff? Are they some combination?
There are VDH staff as well as what we call Vermont Chronic Care Initiative.
Okay, yeah, all right, I'm familiar with that, all right.
Does that make sense? So VDH is the Vermont Department of Health. And so we have both public health nurses and nurses who do complex care. Sorry, Chair, I just want to make.
Yeah, that's
clarify
what was confusing me a little bit because it sort of was lumping them together and that's what I was trying to figure out. Okay, thank you.
And when we talk about our public health nurses, they administer programs like the Women's, Infant, and Children's Program, or otherwise known as the WIC program.
Go ahead.
With respect to the nursing services provided for the case management in complex cases, is that for people who are receiving Medicaid?
Primarily.
And outside of that, what other instances besides Medicaid
Yeah.
cases might they be in?
So most of the cases that we encounter at the local level that are very complex. So individuals who generally don't have just healthcare needs, but also other psychosocial needs, typically qualify for Medicaid, or at times are uninsured, and we're in the process of working to enroll them in Medicaid. And the Vermont Chronic Care Initiative takes a pretty significant role in working to assist people who need that level of complex services and in getting enrolled in the Medicaid program. I don't know whether you want to add to that.
The only thing I would add is we do have a small number of Vermonters that are enrolled in both Medicaid and Medicare. And so this team of nurses could also support those individuals.
And the complexity refers to sort of the wraparound nature of services needed, not necessarily that it's a particularly complex medical issue.
Correct.
Okay.
And you'll hear us.
Really isn't, I mean.
Yeah, it's both. And so you'll hear us talk a lot about team-based care. The magic of that team is that we know that there are often a lot of providers in our community working with people who are complex. But the best way I can synthesize it is when a provider is going like this, they're just not sure what to do. We've got this team that typically keeps a caseload of 25 or so cases. Typically in other areas, they might serve 100 cases. So this is a group of people whose primary role is to work with a small number. They have small number, they're incredibly flexible. They convene a team, and that team often includes a housing provider. It includes a mental health agency, substance use, if that's the case. Each of those teams is based on what that individual's needs are, their primary care practice. And they work to kind of identify what type of a team person needs and to get them connected. And then they hand them off to someone who can be the long-term lead care coordinator. So they're really identifying what are the full breadth of services, which are the agencies that are best to serve that person long-term. They convene them and they create a common care plan across the boundaries of organizations so that, you know, we don't have a person who's being overwhelmed with 10 different like primary goals and objectives. You know, when was the last time someone came to you and said, you know, you have to do X? I'm a dentist, get in line, like behind everybody else. So this helps to get the group coordinated around what that person's goals are, so that we're really being person-centric.
Thank
Yep. And I get really excited about that. I get really excited about the team-based care work.
Yes, it's excellent work. In addition to the team-based care and the nurses at district offices, there's also the children and family support. So support for those who are going through adoption, for foster care, really ensuring child safety at each district office. Also at the district offices, they provide economic services to individuals. So assistance for food, financial assistance for food, or temporary housing, or fuel assistance, as well as case management for all those services together to really help navigate and advise what services and benefits a person's eligible for. In addition, employment and job training is also offered, primarily for those with intellectual or physical disabilities. And lastly, we have parole and probation at the district offices too. So that includes supervision for the parole or probation, rehabilitation programs, and ensuring completion of those court-ordered services.
Make one comment.
Of course.
I think what you will see here, which we did this by services, but the majority of the departments within the Agency of Human Services are represented and have a footprint at the local level.
Correct. Yes, thank you. The only other thing that I'll add to that is there's a lot of other state employees in the district offices that aren't part of the Agency of Human Services. And our labor colleagues are a great example and like to identify themselves as part of the AHS team and all the things that we do because it is such a collaborative space. And if you haven't visited your local office, I think it's definitely worth a visit. So now we're going to step through the departments at a high level detail. I'm going to start with the Department of Corrections. So on the left here, we have the map of the facilities. And for Department of Corrections, there are 6 facilities in the state, 5 male facilities. There's 1 female facility, and we have 1 facility that's out of state. We've already talked about the 12 probation and parole offices. What's unique about Vermont for the Department of Corrections system is it's a unified system. So it's really end-to-end, meaning it offers pre-trial supervision. So supervision in the community before someone goes to trial. It includes, in the Department of Corrections system, detainees, so people before they're sentenced. It also includes those who are incarcerated, who have received their sentence, and then the community supervision part, which is the parole or probation. And the other item to note in the yellow on the map, that is the training center. So all correctional officers go through the Vermont Correctional Academy, which is a standardized training model and system for every officer. Okay, so I'll hand it over to Monica.
Everybody. Our next department is the Department of Disabilities, Aging, and Independent Living. Their mission is to make Vermont the best state in which to grow old or live with a disability with dignity, respect, and independence. See a lot of those same trends here in your guiding principles. So that's really wonderful to see there up in writing. What's that?
Thank you for helping to write that.
I appreciate it.
I was the leader on this one.
And look,
It's withstood the test of time, let's just say, it's withstood the test of time.
right. I do love that. Nice to see the legacy going strong. When I think about this Department of Disabilities, Aging, and Independent Living, and I explain it to individuals that might be new to the Agency of Human Services and our structure, this is where a lot of the work around, say, nursing homes live. or individuals that are aging in Vermont that want to stay in their home and might get services in their home or in their community. So things like help with feeding, dressing, those things we consider our activities of daily living, transportation, getting about your house, and integrating into your community. We know we have an aging demographic here. This department is working really, really hard to support our aging demographic. If you haven't seen their Age Strong plan, I highly recommend taking a look. We also see a lot of disability services and supports coming out of this department. That's for all ages and stages of life. So this is for our children and youth that are really young, newly diagnosed with a developmental disability that we know that they'll live with throughout the entirety of their life. So how are we wrapping them with supports and help both in their school, in their home, in their community so that they can thrive? And then there's other small parts of the department that I don't know always get quite as much airtime. So when we think about the Office of Public Guardianship, where we're supporting Vermonters who might not be able to speak on behalf of themselves. And so these are a group of individuals that are really working to advocate on behalf of them and to support them live their best lives.
Representative Bishop.
Reminder, freshman Representative Bishop, so I'm still trying to get a handle on these things. So what you were just talking about here with Dale, are those services delivered by the designated agencies, directly by AHS, or sometimes in combination? How is that?
Great question. Through Dale, the vast majority of our services are being delivered by community partners. So the designated agencies is a great example that the secretary spoke to earlier. Also, the Visiting Nurse Association and home health agencies throughout the state of Vermont, huge partners there as well. We also have a broad workforce of personal care attendants that are hired by families to support individuals with all types of different needs in-home around their activities of daily living. And when I say that, it's kind of a buzzword, right? But what I'm talking about is eating, bathing, transferring from, say, a chair to a car or to your bed, those types of skills. And so it can be a variety of different organizations or individuals that are creating relationships with families to support loved ones at home. Yeah, of course.
And if I may, since you asked the question, but this department and many of the departments, so as you go through, I think this will hold, they have, as I mentioned before, they have a dual role. So the Department for Disabilities and Aging Independent Living and the next department, the Department for Mental Health, their goal and role is to ensure that we have the services to serve all Vermonters who meet the needs that the department provides. So assessing what are the disability services that we need, assessing the mental health services. They play the role of doing that for the entire population, ensuring that we have access or that we are building towards the access we need. They also play a role as being the department that administers the Medicaid program. So ensuring individuals who are enrolled in our Medicaid program are able to access the services that they need and paying for those services through their department. And so I think that that's really important to recognize the two hats that most of our departments play. That means that many of them play a regulatory, in addition to providing care, many of them have a regulatory component. They have a component where they are doing monitoring and evaluation of the system broadly to ensure that the system is meeting the needs of Vermonters, as well as paying for those healthcare services. And so I often think of those as the broad roles that departments have, but they do it, some of them for the whole population and much of it for the Medicaid population. So.
Next is the Department of Mental Health. Their mission is to promote and improve the health of Vermonters. The Department of Mental Health does have one facility, the Vermont Psychiatric Care Hospital, but outside of the hospital, they are very much in the community and in our schools through the designated agencies, for example. They also have worked tirelessly for the past several years to create services and supports available to people 24 hours a day, 7 days a week if you are in crisis or feeling scared and need support. So a great example of some of the work they've done recently has been 988. Anybody can pick up the phone, dial 988, and you will be in touch with somebody that can support you if you are in crisis. Taking it up a level, we also have mobile crisis. So if there are individuals out in the community that need in-person service and support, we're now able to deploy those types of services and support statewide. And so I think that that's a real critical example of the types of things that this department has done to try and bring things upstream and into the local community for individuals, and not just say in an office, how we often think about mental health as being something that is in one space, a one-to-one counseling type of environment. It's really something that we're trying to normalize and make available to people in the community, given what we know Vermonters are facing at this moment in time. Next, we've got, I'm in the right order. Health Access. Okay, the Department of Vermont Health Access. Representative, you spoke to being a freshman. This is where I was a freshman in state government. At the Department of Vermont Health Access, we fondly call it DEVA. They are no more diva than anyone else, so they will tell you that. Their mission is to improve Vermonters' health and well-being by providing them with access to high-quality, cost, and effective healthcare. Very simply put, DEVA is the workhorse of Medicaid. They are our health insurance operator. They're the department that oversees helping Vermonters get enrolled in Medicaid, helping providers become Medicaid enrolled providers, processing claims, but also ensuring quality and monitoring things like fraud, waste, and abuse, and making sure that all of our systems and supports in place as an insurance provider are working to the best of our ability. Any questions? It's a complex one, yeah.
One of the things as I look down through the list of things, one of the things that sort of pops out, some of these things really cross over into other AHS departments. So when I think I'll just use Dale as an example, and I see long-term care Medicaid program there, and know that Dale really essentially operates the long-term care services and policy. So maybe you could just briefly talk about how those two things intersect.
Yeah. So the eligibility for long-term care Medicaid is managed in partnership between this department and the Department of Aging and Independent Living. Long-term care Medicaid is for individuals on Medicaid who are likely to need support for the remainder of their life. So perhaps they want to pursue that support at home in their community. Perhaps they want to get it at a nursing home. But in order to know if somebody is eligible for long-term care Medicaid, there is both a clinical eligibility piece, and that means really looking at the person's medical records and seeing what their clinical or medical needs are. And that piece is done at the Department of Aging and Independent Living. That's where that expertise lives. And then there's a financial component of that eligibility. That lives at the Department of Vermont Health Access at DEVA. And so those two pieces together are what help us determine if somebody is eligible for long-term care Medicaid. So you're absolutely right. The Department of Vermont Health Access is the pillar of our state's Medicaid program in terms of operations, but it is in very close partnership with our departments that have the expertise on, say, the program part, the programmatic components, or the content, so mental health, disabilities, aging, et cetera.
And what I was getting at is the distinction that you made, which was that DEVA is really the entity that lots of the programs in the departments that we work with are Medicaid programs. Those departments don't by themselves determine Medicaid eligibility. Once they've been determined eligible for Medicaid, then they're able to receive services from these departments. So that's what I was just trying to get at. And thank you.
Yeah, that's a very good and concise description. And so then I think what's important is then the programs are administered by those other programs. So you'll hear us talk a little bit about Choices for Care. That's a program where individuals are able to get services in their home as they age. and otherwise would have been living in or getting care in a skilled nursing facility. That's administered by the Department for Aging and Independent Living. I think
I'm always gonna say disability.
aging and independent living.
You say Dale.
Dale,
Yeah.
I'm really working hard not to do
I know, that's all right, I appreciate that.
So it over at Dale. I think it's with the other component that folks may not know, but DEVA, Department for Vermont Health Access, DEVA administers the health exchange. Many people know it as Vermont Health Connect. And so they're the ones who directly contract with the insurers and have and do the enrollment. And so we're leveraging our Medicaid enrollment with individuals who are enrolling who might be in a small group market or in an individual market who are enrolling in health insurance. And so we're able to leverage both those. So those are two sides of the house. Everyone thinks of DEVA as just Medicaid, and they do mostly Medicaid, but their expertise is in being an insurance provider. And so they also do the eligibility and they work on doing the eligibility and enrollment for other types of plans.
And then the Vermont Department of Health. Their mission is to promote the physical, mental, and social well-being of people in Vermont by advancing equity, protecting against disease and injury, and preparing for health emergencies. Vermont Department of Health, in one way or another, probably touches all Vermonters, even when we don't even know it. So every single newborn in the state of Vermont has a newborn screen to check for over, say, 30 genetic disorders, and a hearing screening to check for the hearing health of the newborn. All of that happens at the Department of Health. They also have oversight and support our environmental health efforts. They have a whole division dedicated just to chronic disease management. They also have an incredibly significant presence in the local community. So when we showed that map and looked at all of the different services are there, a lot of those are Vermont Department of Health employees there, and they can show up in a variety of ways. For example, they've got a nurse in each office that has all of the routine vaccines, flu vaccine, COVID vaccine that can be administered to anybody if they don't have access to those vaccines on their own. So really taking that public health approach and trying to support our entire population. Additionally, one of the divisions we wanted to highlight here, because you'll probably hear quite a bit about it, it's a priority for us, is the Division of Substance Use. We know that this is a huge space of interest to this committee and to many in Vermont. We're working very hard to make sure that our Division of Substance Use is closely integrated with our Department of Mental Health. We know that there is an incredible amount of overlap and increasing complexity in people that are suffering with substance use, and see that coexisting nature of mental health and substance use becoming more and more pervasive. And so the better we can approach the way we're caring for people with those co-occurring disorders, the better we can support them in having good outcomes. So we know that our system of care needs to meet both of those needs, always at one time. Yeah.
And the next department we'll go through, which is the last department, is the Department of Children and Families. And for all the departments, this is probably our broadest one with the most diverse services that are offered within it. And the way I think about the Department of Children and Families is really two arms to it. I think of it as a part of the arm is offering caring for children, and another arm offering the financial side of it for children and families. And when we talk about families, it also could be a household size of one. So I just want us to keep that in mind too. So Department of Children and Families, DCF, it has 6 divisions within it. One division is the Family Services Division, and this deals directly with children and families. So ensuring children are safe and doing investigative reports if there are reports of child abuse or neglect. The other division within that kind of caring arm of children is the Child Development Division. So this group partners with child care centers to offer child development services.
throughout the state. Now I'm going to shift to the other arm, and this is really the financial services offered to children and families. So we have the Office of Child Support, which just celebrated their 50th anniversary. So a huge milestone. And this group is responsible for determining parentage between a child and a parent, as well as ensuring child support is being paid and monitoring that payment. Another group is the Economic Services Division, also known as ESD. And this provides financial assistance to Vermonters. So think of food, fuel, general assistance, which I'm sure you'll hear plenty about. That's part of the General Emergency Hotel Motel program that lives within the Enterprise Services, Economic Services Division, ESD. Another group is the Office of Economic Opportunity. Similar, but a little different. They provide grants to community partners to really fund activities within the community. So such as shelters, which I'm sure we will also hear more about, as well as weatherization opportunities. So really working and funding weatherization improvements for people's homes to really keep the heat in and improve that. And last but not least, and they often do fly under the radar, is the Disability Determination Services, also known as DDS. And this group determines medical eligibility for disabilities on the federal side. So they follow the federal rules and regulations. And one of the notable items of this team is they are often national leaders in accuracy and timeliness for their eligibility determinations. So a nice shout out to that group. So that rounds out DCF for us today.
One of the things I want to highlight, often asked me when we talk about the child development division and the child development services. One of those services is funding our preschool, our pre-K programs and our childcare programs. So.
I'm sure we're gonna have lots of discussion about that and the funding mechanism and estimates about that as we make our way through BAA and budget. Okay. Sort of any sort of like general questions that people might have. It's a lot to take in, and you'll probably even feel a little bit even more overwhelmed when we talk about BAA and budget, because we'll get into each one of the three departments that we have responsibility for in a lot of detail. So this was just to kind of like whet your appetite for getting an understanding of that, and to see some of the key players that we have in state government that are guiding our response to Vermonters and the state as a whole. So any other questions? Yeah, go ahead, Representative Cole.
Thank you. Thank you so much for being here. And it's great to have the intro, especially as a new member on the committee. One question that came up just in response to one of your very last comments here had to do with Social Security disability, kind of in connection with the GA program. And for the folks, I had this like recurring pattern with folks that I was working with the GA program, that many of them who were trying to get out and not rely on that program anymore because they wanted to get their own income for their own housing. One of the biggest barriers that seemed to come up time and time again, only from my experience, I don't know about from everyone's experience, but was that SSDI verification process. And so it was really interesting to hear that actually in Vermont, we're hearing that actually has been super efficient. And so I'm wondering what the disconnect is, and maybe how we could bridge that, like, just because on the ground, that wasn't necessarily no criticism to you all, that kind of just came up as a question.
Yeah, Vermont is known as a leader in that, and particularly around timeliness and determinations. I think one of the best things to do is in the coming weeks, you'll have an opportunity to meet with the Department for Children and Families. And I think being able to dig in with them about what that process looks like, or even offline with the commissioner in that department, I think you'll get a better sense of what that process looks like. Is there anything specific around it? It's a good point. I hear that a lot.
Yeah.
But Vermont is recognized as a leader across the country.
I'm wondering if, this is just a wondering, frankly, so, we have good statistics in our response rate and determinations, and does that also include, appeals? So I know people will often say, I needed to appeal before I actually, felt like my case was really heard. And so I'm wondering, Representative Cole, whether or not that's reflective of the people that maybe you're speaking to, but do those national statistics include, or maybe we can ask Chris, but do those national statistics include appeal rates and things
What I'll
like
do
that?
is I'll have Chris pull together some, have Brennan have Chris pull together some of the data on that and have him send it over unless you have something else.
No, I think Chris will probably have the details.
Okay, all right, thank you.
The only thing I'll add,
And Chris, for everyone, is,
yes.
it is Chris Winters, who's the commissioner for the Department of Children and Families.
the only thing I can add to that is, I was director of children with special health needs for a long time. And so spent a lot of time sitting alongside families, looking at these applications, and they are lengthy. And we at the state level don't have a ton of control over them, unfortunately. Some of that is federal. And so while we do have children with special health needs, for example, we have people that will sit down with families. I've done this before, sit down, tell them how they can fill it out, what type of information they need to gather, but it is not intuitive. And especially if English is not your first language, or if reading healthcare paperwork is not your first language, and I don't know whose first language that is. I'd like to meet them. So it is, the struggle is absolutely real. The statistics are wonderful, and there are still families that are having a hard time with it. So always happy to hear more about that.
Thank you.
Yeah.
Representative Nielsen.
I was recently kind of dealing with you people, no offense. One of my constituents had a wheelchair, he had self-palsy. Can't talk sometimes. And I went with him to Burlington to the I can't think.
Like a medical store or something?
No. I went to the building of UVM.
Okay,
And he went to a wheelchair clinic and his wheelchair is all screwed up. It works. I found him another one, but he's got to get turned down by Medicaid. They get turned down by Medicare. And he wanted to answer for like freaking 4 to 6 months. I got another wheelchair. He has one. I got another one. He has to ride one of those 4-wheelers. Why do you think I'd be so tried out? Why do you think I'd be so drawn out? The guy's got cerebral palsy, like 40, 50 years old. He can walk a few feet, which amazes the hell out of me. I don't even know how he does it. And obviously he's been like this his whole life. And you're kind of torturing him by like dragging it out so long. I can't understand it. Is this your department or?
I can't speak to a specific case, so.
No, I'm just
yeah.
talking in general.
No, I would have to have more information. Medicaid is administered by the Agency of Human Services. I think this brings up a good point. The reason I want to bring our leadership team here is that if you have a constituent who is really struggling, we're here to help. And so whether that's getting Brendan the information so we can get it to a specific department or Medicaid reaching directly out to Monica, sometimes we can help sort out whether it's what the issue is. Because as Monica said, many of the programs that we have are federally funded. They come with federal funding and restrictions and mandates, and we can help people navigate through that. So we're here to help. I can't speak to this person's specific situation, whether it intersects with our agency or not, but it sounds like if they're trying to work with Medicaid, it does. Let us know who they are and we can.
We were explained by the person that works in the wheelchair clinic, this is basic procedure.
Yeah.
And it doesn't sound right to me.
Yeah, I can't speak to it. So if you happy to take it offline, if you can get me the information, we can look into it.
But I got him another wheelchair, put on front porch for him. Actually, it's a lot better than what he has now. So I dealt with it.
I've spent a lot of time with the wheelchair clinic.
Yeah, it
So
can be really,
happy to connect.
yeah.
Well, thank you.
Yeah, of course, absolutely.
Well, thank you so much for being here, all of
Thank
you,
you.
and appreciate the time and attention and answering our questions and the overview. And we look forward to seeing you back here when we're looking at the governor's budget in just a few days.
Thank you, and we appreciate our work and look forward to work together with you over the session.
Thank you. Okay, committee, you've got like, let's just say 5 minutes to stretch. Excuse me. We have 5 minutes to stretch, but we are going to then follow up with Emily Byrne from the Joint Fiscal Office, who is going to give us an overview of Budget Adjustment Act and some basic information about that.